Then I guess I opened the bottles and I realized, hey, wait a minute, that looks just like my Synthroid. And it was. But I survived.
Okay. The second right is the right medication. Once you've got the right drug, make sure you've got the right medication, okay? Lots of drugs sound the same, okay? You know, we talked about Prilosec, the over-the-counter drug. When that drug first came out on the market, it was Losec 20 milligrams. It wasn't Prilosec. The brand name was Losec 20 milligrams. How many errors were made for Lasix 20 milligrams instead of Losec? The FDA made them change the name to Prilosec to prevent that error. So lots and lots of things sound the same. Zyrtec, Zyprexa, Acifect, and Aricept. There's just a lot of things that sound the same. So make sure you know, in fact, what you're giving that resident, okay? The worst error I've ever been involved with in pharmacy occurred in this way, where a person similar to you has got the wrong drug. And how did it happen? We had an order in a nursing home in Massachusetts, and the order read Capitril 37.5 milligrams 3 times a day. Now Capitril doesn't come 37.5, it comes 25, 12.5, or whatever. So there were two ways you could get to it. You could give them 3 12.5, so you could give them a 25 and a 12.5. Similar like Lasix doesn't come 60, so you got to give a 40 and a 20 or 3 20s. Well, the pharmacy, because of Medicaid rules in Massachusetts, had to give 12.5 milligrams of the Capitril, 3 tablets 3 times a day. Perfectly legit. So they did that. I got a call from a consultant pharmacist, and you can tell I'm a little bit sarcastic. But he said to me, have you ever heard of anybody with a digoxin level of 15? Now, if the labs for digoxin is between 1 and 2, is what you want that drug level to be. And I said, not among the living. I mean, 15, they should be dead. I mean, really? He said, this lady's got a dig level of 15. So they sent her to the hospital. They got her back, and she was on digoxin, so they canceled the dig. And they got her back, and all of a sudden her dig level was 9. So at that point, they said, oh, let's go to the cart. So they go to the cart, they pull out the drugs. Well, that Capitril is a little yellow tablet, okay? Digoxin is a little yellow tablet. And digoxin comes strength 125. Now, Capitril was 12.5, 125. Digoxin is 0.125. Well, of all those 9 cards, they were using bingo cards, one of them had digoxin instead of Capitril in it. Okay, now the sad part is, now definitely a pharmacy error, there's no denying that. But there was a pre-packed label, right, there was a label, the pharmacy label that said Capitril 3 tablets 3 times a day. Literally right next to it was a label that said digoxin 0.125. So the person didn't verify that right tablet. They could have looked right at that pre-packed label and realized, that's the wrong drug, okay? But here's the real lesson to be learned from that. Number one is that when something goes that fluid, somebody ends up with a dig 15, you should make sure that the first thing you do is blame the drugs, okay? She comes back to the facility and ends up getting it again because they didn't blame the drug the first time. So when something goes that wrong, look for the drug, okay, to make sure, in fact, that you've got the right drug. If they'd gone to the cart again, they would have prevented the second occurrence. So make sure you've got the right drug. How do you do that? You gotta make sure the bottle's labeled, whatever. However you verify that that is in fact the right medication. Like you checking the strengths against the others, make sure you're doing that. Because you're really on the line by signing off on that med sheet. And I don't want to scare you, but there's a lot of responsibility to it. It's not an easy thing.
And they can look different from month to month if you get different generics.
And here's the reason around that. We really work hard not to do that. But what happens is that generics, one company will run out and somebody else will make a different one of a different color. Or it'll be a much better deal for your resident to give them something a little bit less expensive by buying a less expensive generic for them, so they'll switch back and forth that way. Everybody know the difference between brand and generic name? I'll tell you anyway, because whenever a drug is invented, the manufacturer has a 17-year patent on the drug. Okay? Just like any other invention, if you invent something, you want protection so that nobody else can make that product for, in our country, the law is 17 years. So when a drug company discovers a medication, they have 17 years protection where they're the only ones that can manufacture that drug, okay? Now lots of times it takes 10 years before that drug can come to market. So now they have 7 years to make up their cost of research and everything. At the end of the patent, 17 years, anybody can manufacture the chemical at that point. They have to meet standards, and generics are just as good from an FDA standpoint. They have to meet the same standards as the brand name, except those folks don't have the research cost to make the drug, so they can sell it for so much cheaper. Okay, so that's what happens. Every drug has a brand name and a generic name. We'll get calls sometimes, give me generic, I don't know, Seroquel. Well, there is no generic. Well, it has a generic name. Well, every drug has a generic name, which is its chemical name. And then whatever the manufacturer decides is its brand name. So that's the difference between the two, okay? So make sure you've got the right drug, okay? The next thing is the right dose, okay? Make sure that you in fact know what your dose is, okay? And it can be confusing. You know, drugs are in milligrams, they could be in micrograms, liquids may be in drops, creams, inches. I used to say, you know, if you've been around a while, you know, there used to be nitroglycerin before we had patches, which we don't really use that much anymore either. But we used to have it, they used to measure it in inches. You get a little thing and you measure it and you put it on a little piece of paper. And I always said that's gone by the boards. Well, there's another Voltaren gel. I don't know if anybody's seen that, but it comes with papers that you measure it with. So it still does, it still gets measured that way sometimes, okay? But make sure you know what the dose is, okay? So Unicare example, I had a nurse called me and said, you sent, again, digoxin, the wrong strength digoxin for this patient. Dig comes 125 and 25. And I said, really? She said, yeah, you sent 0.25 and it's supposed to be 0.125. And so I said, all right, go get me the fax, okay? And use faxes for your orders, okay? Most people do, okay? How often on your fax machine do you clean the lens that's on that fax machine? Did you know? Once a week, twice a week? Did you know it had a lens? Okay, you've all got faxes that have like a black line down them, or a little bit of a line. Well, what happens is there's this little thin piece of glass, you'll do it afterwards, there's this little thin piece of glass on a fax machine if you lift up the cover, and what happens is that gets dirty. So you feed the paper through there, and that little speck of dirt blocks off whatever's on that fax, okay? So you should just take an alcohol pad at least once a week and clean those off, okay? But this fax came through, and I looked at the fax, and it said digoxin 0.25. So I, you know, bold as I was, got in my car and went over to the nursing home, and I said to the director, I said, here's the fax. And so we went up to her floor, we pulled her fax. If you looked closely at what we received, there was not a black line, but a clear line that literally went straight down and struck out the 1. So now all of a sudden it was 0.25 instead of 0.125. So the moral of that is, I love technology, and I'm a technology geek in my business. But make sure you're cleaning your fax machine, okay? It just makes a lot of sense to do that, okay? The right time. So you got the right resident, getting the right drug and the right dose at the right time, okay? Make sure AM and PM, there's different, not a lot of meds have to be given at night. Some work a little bit better at night. Statin drugs for cholesterol seem to work a little bit better at night. But know your frequency, once a day, twice a day, so on and so forth. Lots of times I have questions about hours of administration, when I can give them. A lot of folks, if it's a twice a day in these facilities, will give it at 8 and 5. And that's usually okay for 99% of the drugs, okay? So you can give it at 8 and 5 rather than 8 and 8. But make sure you know what time you're supposed to give it, because most drugs, when we're giving them twice a day, we're just maintaining a blood level of them. If you've got something like a pain pill that's given twice a day, though, you should give it twice a day, long-acting drug like that, because if you've got a 12-hour MS Contin and you give it at 8 in the morning at 5, well, now they got to go from 5 to 8, so it's better to get that, when it's designed to last 12 hours, to give it exactly 12 hours as best you can. You have an hour from a state standpoint, an hour on either side of when that med is designated to be given to have the resident take it. So if the order says to give it at 8 in the morning, you have literally from 7 to 9 to give that medication and still be in compliance. If you give it at 9:02, you're out of compliance with the state. Okay, so you have an hour on either side to give the medication. Makes sense? I'm getting a furrowed eyebrow.
I know, I thought that was a half hour.
No, it's an hour on either side. You have an hour on either side.
So if you're supposed to give at 2, you have until 3 to give
You have
the
1 to
med.
3. You have an hour window on either side.
So specifically, like Marilyn, if she's out and her family has not given her insulin, and she comes back and her insulin, for instance, is she's home 2 hours later than she should have gotten it. What do you do
Mhm.
in a case like that?
What's the insulin? It depends on the type of insulin. If it's,
Humalog, I mean,
the
it would be
Humalog
a-
is really supposed to give them right when they have a meal.
right.
I-
There's Humalin and Humalog.
Yeah.
Right, but on my
you-
shift it's
Right.
Humalog, yeah. But I mean, it doesn't happen often, but sometimes her family will go out
Mhm.
and they'll come back with her late and she has not had it.
I would pop a blood
needs to
sugar to
have-
see where she's at.
Well, right,
that
we always
point.
do the blood
Mhm,
sugar
mhm,
anyway, right.
mhm.
But then if her blood sugar
Whatever
requires it,
parameters they have, I give it then.
okay.
Yeah, you don't want it to be
It
high.
doesn't happen often, but it
Yeah,
does
but it
happen,
can, yeah.
yeah.
Mhm. Go ahead.
Like Lynn just said here, it's always been a half hour.
That's
for-
fine, whatever you, I mean.
But what I'm
mhm.
saying is, it's okay for our facility to say
Absolutely.
differently as long as it falls within the state
As long
parameters.
as you don't
Right.
say it's
So
2
we-
hours.
right. We
Yeah,
can-
that's fine, absolutely.
We can
Yeah,
keep doing
yeah.
what we've been
And,
doing.
and really, that's why the Board of Nursing says you do things a little bit differently than here.
Mhm.
That's why you wanna make sure you're following whatever standards your home has.
So an hour, as much as an hour before, an hour after is okay.
But-
Follow this
But
facility's
you
rules.
say a half hour, so we do a half hour.
Right.
Okay.
Yeah,
That's
yeah.
okay.
And it just gives us our leeway, that
Absolutely, you've got a
leeway
lot-
too, is what
you're
it
never gonna
really
be wrong.
does.
You're never
You
gonna
can't be wrong in that way.
Right.
I mean,
would
the
agree.
state says 1 hour, we say 1/2 hour,
Mhm.
we're safe,
That's
no
right.
matter what,
I-
we're safe.
I think it
Yeah.
makes sense to do it
Yeah.
that way. That's how I would.
So-
do it.
Yeah.
The state, you know, I don't wanna get tangential here, but I have homes that just say take in the morning. And the state's
Mhm.
okay with it.
There's no
I was really shocked when the first home said, I want you to label this AM, noon, and PM. I said, are you kidding? I said, did you clear that? Yeah. And if the conference they said that, I'm thinking, I wouldn't do that. I mean, what's AM? Is it 11:30? And then all of a sudden I'm giving it at 1:30? I would just, I think times are much
Mhm.
better, much safer.
How about,
I do what I'm told to do by the customer.
is this, like if your grandmother's in the nursing home
Mhm.
and she's supposed to take a pill at 7,
Mhm.
but she's stubborn and doesn't get out of bed till 9,
Yeah,
are,
I would document that,
oh,
and I
okay.
would say, and then I'd try to change the time.
Okay,
I would change that time to try to go around it, you know, unless the physician specifically wants it at 8, and I can't understand why they would. You know, sometimes they, and I don't know how legal, I haven't been in the nursing home business in, thank goodness, 7 years. But I would get that changed. Sometimes you can put upon arising, I mean, you know,
Oh.
sometime, but I don't know if the nursing home allows it, so I'm just not familiar enough with nursing home
Okay.
rules now,
Just
so,
curious.
okay. PRNs, obviously as needed, make sure the resident, and this is one of the reasons we talk about in documentation, why it's so important to document stuff, because if somebody has an order for medication as needed, and you give it before you leave your shift at 7 o'clock in the morning, and you don't write it, and our folks are a little bit demented, don't remember, I don't remember if I took something 20 minutes ago. And then they say they want it again, if it's not documented, then somebody else could give them another medication.
If somebody takes like a hydrocodone mixed with Tylenol,
Mhm.
before the 4 hours is up or 6
Mhm.
hours before that, can they have regular Tylenol?
I would think they could,
Okay.
yeah.
I
If
know
they have
there
an
was
order
some
for
kind of
both, I would
range.
just, again, we'll watch the dosing and we'll talk
Okay.
about Tylenol dosing. But yeah, I don't know why they couldn't. The key is you wanna make sure you give them enough time for that first one to work.
Okay.
That's really the key to all of that, because literally they won't remember they've taken the med.
I've had that happen.
You'll have
before.
that happen, certainly in this
Now, I got a
business for
question
sure.
about the PRN.
Yeah,
Like we all know with Jenny her Tums, it's written as a PRN.
Yep.
She takes it every night.
Yep.
So why is it a PRN? Why doesn't it come through as PM?
you have to ask the doc.
Okay, so
He-
it's a doctor's
And he-
issue
Yeah,
then.
it's they've signed off on
Okay.
that order, yeah,
Mhm.
that's the
All right.
issue. No, I mean, Tums is such a benign
Oh,
thing.
yeah, I know that.
mean,
It's
yeah,
just- it was
yeah,
an
but you
example.
could have, again, like I talked about, somebody
Right,
who's all of a sudden in pain before they get a pain medicine.
right. It was
We should
just
be
a,
good
yeah,
friends.
an
Mhm.
example that
I have a
happens.
question about that. I have somebody who takes Tramadol on a
Mhm.
scheduled basis,
Yeah.
but then she also has Tramadol as a PRN.
Mhm.
They're
I'd,
not,
I'd wait an hour,
okay.
at least an hour. And Tramadol, we'll talk about Tramadol when we get to the meds, but Tramadol is not as benign a med as we once thought. It's
I
pretty,
actually take
it's
that.
pretty addictive.
'Cause she,
You'll see withdrawal with that drug.
she,
Yeah.
she takes it 4 times a day, but now, I mean, within the past week now, she has it as a PRN as well.
Mhm.
So she's getting it in her packets, and then she's getting it as a PRN.
Here's one thing I would say with something like that, if I was talking to the doc about it, I'd say, why does she need a PRN?
Mm.
Why, can we increase the dose of that routine so she doesn't require the PRN? If it's only spotty, I mean, if all of a sudden you see her saying, boy, every day, she's
Really
taking that
would be.
PRN a couple of different times, I'd get her reassessed instead of adding it. And say, maybe she needs another drug or she needs a higher dose. You know, one of those things, okay? So that's the right time, okay? and then via the right route, okay? Obviously PO by mouth, IM, you won't give any injections. Subcutaneously, you watch, your PREP will do that. Drops, suppositories, patches. Here's a rule about a patch, okay? Take off the old patch before we put the new one on, okay? I shouldn't laugh, but we had somebody end up with 9 Exelon patches on in the hospital because they got wicked side effects from Exelon. I almost laughed when that drug came out because Exelon's obviously for Alzheimer's. So not so much in our business, but at home. How many patches you think some of these folks have got on at home? I'm telling you, they got
That
more than
one?
one.
I know you're supposed to move it each time you put it in one. Is that just with that patch you're supposed to do it, or with
Yeah,
every
that,
patch?
I would do it with any patch because, and not so much that the patch itself will be a problem, but the adhesive might be a skin irritant more than anything else. And patches, just sidetrack a little bit, but patches are really good. Okay, they force compliance, they work well. But we do things so stupid sometimes with patches. You know the drug Duragesic patch? That it's for pain, okay, and it's like 25. Well, patches, and they're designed to be changed every 3 days. An Exelon is 24 hours, but a patch is designed to release a certain amount of drug over a 24-hour period. So if you have a fentanyl patch for 25 micrograms, it's designed on day one, designed to last 3 days. So the first day it releases 25 micrograms. The second day it releases 25 micrograms. The third day it releases 25 micrograms, and then the drug's pretty much used up. There's still always some residual in there. But then you take off the patch and you put a new patch on. And what I see, and you may see it if you're in the business long enough, is all of a sudden we'll get an order that says fentanyl patch 25 micrograms, change every 2 days instead of every 3 days. Now that makes absolutely no sense because if you think about what I just said, okay, I put that patch on day one, how much do they get? 25. I put it on day 2 they get 25. I take it off, I put a new one on, how much do they get?
25.
They're wasting a third of that patch. When that happens,
It's expensive.
it's very expensive. It's the dose needs to be raised. Okay, it has nothing to do with the duration of the patch. But you know what they say. You know, if I tell you that's going to work better if you change it every 2 days, it's going to work better if it works if you give it change it every 2 days. The placebo effect works. Okay, back in the I can say this now because I'm a little older. Back in the good old days, we used to give out sugar pills. We had a pink, number 1 pink capsule, a number 2 green capsule, and they all had sugar in them. When I was in college, we had a lady who was getting Percocet in the hospital every 4 hours. And she said to the the intern who I was working with, I have to have a shot. I need a shot to help me with my pain. And he says, you know, you're getting Percocet. I know, but I need a shot. So back in those days you could do this. He went to the nurse and he said, okay, give her a saline shot in between your Percocets. You know, you can't do that anymore. But so they did that. And you know, after 3 days, you know what she said to us? I don't need those tablets. Just give me the shots. True story. I mean, if I tell you something's going to work, boy, it's going to work, okay? You're going to wake up at 2 in the morning and have to go to the bathroom. Guess what? With this med, you're going to wake up at 2 in the morning and have to go to the bathroom. I mean, the placebos do work, so they
Why
do
don't they
that.
use them
Okay?
anymore like that?
Because you have to be honest with people. I can't lie anymore. You know? Sorry about that. Okay? But you have to be honest with folks now, and all for the better. I'm not, you know, I might have, but boy, you could do some fun things back then. Okay. All right. So simple job. The right resident getting the right drug at the right time and the right dose for you, the right route. That's what we're all about. That's really what we're trying to do. So grab your books. I'm going to do a couple things, and then we'll take a break. You take your book and turn to page. Just have this down. Funny thing about these books, this is a great book. There's great information what you have here. This is the 10th edition, okay? I had the 8th edition and then the 9th edition. Now the 8th and the 9th edition were like twice as thick.
Yeah,
They
we
had-
have it.
I know, and they had different things that weren't as much. I got the 10th edition. I opened the box. I said, well, I didn't get the right book, but I paid the same amount. I can tell you that. So anyway, turn to page 57. I want to talk to you about the correct way to use inhalers and eye drops and ear drops and those things. Okay. When we talk about dealing with inhalers. Okay, there's 2 types of inhalers to get medicine into the lung of inhalers. We also have nebulizers, but we won't talk about those. But if somebody's using an inhaler, there's 2 kinds. Okay, and this, I'm gonna paraphrase what's in the book, but this is just a good reference, it'll tell you exactly how to do these things. This type of inhaler, it's like an Advair, if you've seen that, or a Ceravent, okay? These are a dry powder inhaler. What that means, or Spiriva is a dry powder inhaler. And what they do is that there's a reservoir of powder in here, and when you cock this thing, you do it like this, that releases a single dose of that powder. Now, what your resident, or if you happen to use one of these, has to do is now they have to suck that dry powder all the way from this inhaler down into their lungs. Okay? That's not easy to do. For me to do it with normal lung function, instead we've got a 75-year-old Alzheimer's patient with compromised lung capacity. And we're saying to them, you've got to suck that powder all the way down into your lungs. Proper procedure, and I won't give you the answer to this because I don't know, but is to cock this thing once, okay? If you cock it twice, guess what? Twice the dose. Somebody asked me what to do if they cock it twice. I have the slightest idea. And I asked all my pharmacists. I said, okay, and it's funny. I've taught this class like 500 people, and for years, like the last 3 times ago when I taught this class, somebody said, "What are you going to do it twice?" I don't know, and I still haven't seen a drug rep. When I see a rep from this company, I'll get an answer. But none of my pharmacists knew either.
You would think that it would have some kind of.
You would think it would have some kind of
something
stop.
to stop.
I never even thought that.
It doesn't.
Yeah.
Neither did I until somebody said, "I got somebody who just does this." So anyway, make sure they're only cocking it once and prevent that. Okay.
But now, of course,
But-
with a capsule, with the Spiriva, they can't get more than
No,
one
they
dose,
cannot.
right?
The
Yeah,
problem with
yeah.
Spiriva is somebody swallows it. You know, sometimes they'll think, oh, I'll just
Oh, they can
and
instead
not
of
put it in their
moving it.
inhaler. Okay, so make sure it goes in the inhaler. But they've got to exhale, put their mouth totally around the inhaler, and then suck as deep as they can and hold that breath for probably 10 to 15 seconds if they can to keep that in there. Okay. With a powder inhaler, it's really, really important that they rinse their mouth afterwards. Now, you want to do it with a metered dose also, but mostly with these, because you can get, a lot of these have steroids in them that help open up the lungs. But one thing about a steroid is if you get it in the mouth long enough, you're going to end up with a yeast infection in your mouth. So you want people to rinse their mouths totally after they've used this inhaler. Okay, make sure they're doing that. Okay. That's a dry powder. The other one, now this is even better. Okay, so now Mary, who's demented with COPD, I say to her, okay, you have a metered dose inhaler. Okay, what you have to do is exhale as much as you can, and then at the same time as you squeeze this thing, you have to suck that in at the same time. And I've seen people try to catch it. I mean, it's just literally crazy what they do. So my recommendation is, if you have people on these, is to use a spacer. And you've seen these, but what this particular spacer, and mine's filthy, don't look at the dirtiness of it. But is you put the inhaler on here.
Do we
Okay.
have to have orders from the doctor to get a spacer, or just from the pharmacy?
Yeah, you do. It's a device, so you want all docs are going to give those. But anyway, is that they squeeze it, and then the medicine stays confined in this area. They exhale, and then they can breathe in. Now this is especially nice because if you breathe too fast, it whistles at you. Okay, so you want just a nice steady breath, sucking that down into the lungs. Okay, and again, rinse it afterwards. Make sure they're doing all that. Okay, that's inhalers. Okay, nasal sprays are, I think, the next. Put this back on so I can see. Nasal sprays are on page 59. Same basic deal is that you want them to exhale, but then with a nasal spray, most nasal sprays are acting locally. We used to have Miacalcin for bones. We don't see much of that anymore. But they act locally, so you're really just going to get them into the sinus in that area, so it's not as tough as getting stuff down into the lungs. But with a nasal spray, like a Flonase, I'm going to hold the other nostril, squeeze, and inhale. Okay? Repeat the procedure on the other side and make sure it's in there. Now, nasal sprays, most of them taste like crap. I mean, they just your mouth tastes terrible after you take them, and it drips for a half an hour. I mean, they just, it's good for diet. I mean, if you do it right before you eat, you won't eat as much because nothing tastes good. But they do that. So most of them act locally. It's not nearly as difficult as dealing with inhalers. Okay. And then the eye drops. I want to spend a couple minutes with eye drops and eye ointments. Okay. Couple general rules when you're helping your folks with eye drops. The first rule is that you never ever touch the bottle to the eye, okay? Because especially if it's an antibiotic eye drop, And you touch that bottle to an infected eye, you contaminate the whole bottle. So you never want to touch that. Or the bottle could give an infection to the eye. I mean, if it's not perfectly sterile when you're doing that. So you want to make sure you never touch. Okay? And the other thing is, when you give an eye drop, you know, you look, like me, I use dry eye stuff on occasion. You know, if you've got a little teeny space here, I mean, you can't hold a lot of volume in that little area of the eye. So you want to pull it down. If they have 2 drops of the same eye drop, I always say do one, wait a minute, and then do the other one. Okay, maybe 2 minutes. Okay, something in between. Don't go plop plop, because when you do, it goes down the tree. I mean, it literally does. There's just not enough room, especially with dehydration going on in a lot of our elderly folks. There's just not a lot of space there. Okay, if it's 2 different eye drops, then you want to wait 5 to 10 minutes. Okay, put the first one in, wait. 5 to 10 minutes later, give the second one. Again, and don't touch the drop to the eye. Eye ointments, now, God bless you. Somebody says, apply a 1/4 inch of erythromycin ointment to the eye. Good luck with that. I mean, you know, it's not an exact science, okay? So make sure you just want to get as best you can, kind of dangle that thing and get it in there, and then have them hold the eye shut for a little bit. A couple things with some of the eye drops and especially with the eye ointments is, number one, it can give them blurred vision, okay? So make sure your folks know, hey, sit down for a few minutes. Don't get up and walk into the wall and fall over and break a hip, okay? Because that can happen. The other thing is, especially with somebody with an eye infection, is that the eye drop may sting like crazy. If you've ever had a kid, you're trying to put Ganterson eye drops in, I mean, you have a raw eye. So make sure, in fact, you know, you let them know, hey, this may sting a little bit, but be careful, just be aware of that, okay? And then ear drops. Now, an infected ear is what we use lots of wax stuff in our business, but with an ear infection, when you're giving the drops, just a couple things. Number one, warm that ear drop up, okay? You know, I don't know if my mother didn't like me when I was a kid, but she used to keep my eardrops in the fridge when I had an infection.
My mother used to warm mine up all
She
the
She
like
used
time.
to
you
keep mine
either.
cold, that's my mother.
Oh, I'm
Mine were
sorry.
always cold.
Exactly. Don't let her do it again. Now, you know, with your kids, okay, they hurt like crazy if you do that with an infected ear. It's terrible. Did she have a sadistic look when she was dropping that in there or anything?
I couldn't see her, I would have a
Okay.
pillow over my face.
Okay. But make sure you're warming them up, okay? And then lay on the opposite side for a good 10 minutes if you can get your folks to do that, so they can get total absorption from that. It's the best thing. The other thing she may have done this to you too. When you have an ear infection, when I was a kid, my mother always gave me a hot water bottle to put on there. Did she do that? Well, that's the same thing, okay? It's
Okay,
the worst
see?
thing, okay, if you think about it, that's the worst thing you can do. Because if you
But it
think about,
works.
oh yeah, it does work. But if you think about bacteria, bacteria love a warm, moist environment to
salt,
grow.
salt.
Okay, so it soothes, but you're just brewing that bug like crazy.
Never thought of
Okay,
that.
and of course not. You know, but that's you want to avoid that if possible.
It doesn't
Make
happen
sure you
that
want-
often.
Okay, all right. So
She's old enough now to take care of
Okay.
herself, so.
that's that's a good thing. Okay. So that's eye drops and ear drops and those kinds of things. Okay, that's my grandson.
Oh.
That's Braden Phillip. He's now 4. Okay, tells how long I've been teaching that. I was in the midst of a midlife crisis when I put this together, because he was just born, so I would have been 52, and I was not old enough to be a grandfather. Okay, now, and so my wife loved it, but I was not real happy about being a grandfather at that point. So I did solve my midlife crisis by getting a bigger Harley. But that's Braden. When you see Braden, you get to take a break. So we'll take just a couple
My
minutes.
dad was 40 when he became a grandfather.
Wow.
My dad had me really young.
In your packets, there's a handout on medication conversion.
I can't do this, I can't do math.
Okay, then you can
She's
leave.
terrible.
We won't do it, but we're gonna make it somewhat easier for you. No, not really.
Good.
What I wanna do with this section, again, it's not part of what the state requires, but I just felt it was important to give you a little bit of a feel around pharmacy dosing and why we do what we do and kind of the conversions between. We'll do some examples. Again, there's no test. I won't quiz you on this, but it's good to hear. It's a simple little page like this. It's a separate handout. It's not part of your stapled ones. It's separate. It's in your folder separate. Did you find it?
Can I take this call? It's the doctor's office.
Absolutely.
Sorry.
That's okay. But it's a separate folder. So what this does is it shows you how we measure things and how we convert things within pharmacy. Now, in the United States, we measure things in two different systems. I don't know if you realize that or not, but most of the world measures things in the metric system, okay? We still use the apothecary system to do a lot of our measurements, so we convert back and forth between the two. For instance, a quart is part of the apothecary system. A teaspoon is apothecary, okay? We don't measure our gas in liters, we buy gas in gallons, okay? That's part of the apothecary system. Most of the world works with liters, okay? And if you were alive like I was in the 70s, there was this big push, we were going metric.
They
Well,
tried to teach
we
the
never-
country, we couldn't
yeah,
learn.
we never learned. We literally never, there was a huge push in the mid-70s, we're going metric.
I remember. I
Well, we
was
never
doing
went
that.
metric, okay? We still, except for our soda, we buy 2-liter bottles of
Right.
soda, but everything else we buy in gallons and quarts and those types of things, so. So I wanna show you, just briefly, show you how this handout works. It's not great, but it's a conversion table. And in the apothecary system, we measure solids by grains. Okay, in the old days, we used to say, take a 5-grain aspirin, take a 5-grain ferrous sulfate. You don't remember that, do you? No, we used to, okay? But we don't anymore. But anyway, the conversion between a grain to a milligram is the way this is set up. There's an approximate conversion and an exact conversion, okay? And to make things more confusing, sometimes drug companies will use the approximate and not the exact, okay? So 1 grain is approximately 60 milligrams, but to be exact, it's 64.8 milligrams. So if I say to you, take a 5-grain aspirin, it's 325 milligrams, which is how we measure our aspirin. Same thing with ferrous sulfate. Now this one, it's one of my examples you'll see. But lots of companies would convert that using the approximate. So you get a ferrous sulfate that said 300 milligrams. Then you get another one that said 325. And there was confusion there because of how they converted. Same amount of iron, it just was converted a little bit differently, okay? Liquid measure is a liquid measure, okay? A teaspoon is always 5 milliliters, okay? So if you're taking a teaspoon, and you do see orders, take 1 teaspoon. Hopefully you're using dose cups, you're not going down to the kitchen and getting a teaspoon. I mean, but you might. I mean, so if you will at home, I mean, you don't have dose cups at home. But a teaspoon is you do that.
I know I'm looking at her. 'cause
I've run for a teaspoon. Have you run
We've
for a
done
teaspoon?
it.
That's okay, that's allowed, okay?
There's no cup in there.
Oh, you always used it,
Figure
always
out
used
what
it.
exactly
Pour
this
it in
3 mean.
Oh yeah, always did, okay? So anyway, a teaspoon is 5 milliliters, the conversion. A tablespoon is 15 milliliters, and you do see like potassium is measured in tablespoons. Here's a funny thing, when I was in my last year of pharmacy school, in pharmacy lab they said, the professor said, I want you to bring in a tablespoon next week to lab. And I'm looking at him, and here I am, I'm living in an apartment in Boston as a student, I got like 5 things in my silverware drawer. So I grabbed what I thought was a tablespoon. Well, when I got there, I realized it wasn't a tablespoon. It was bigger than a teaspoon, but it was really a dessert spoon, which is 10 mLs. And if you look, a teaspoon is really good size. So if you're measuring at home with a tablespoon, make sure you got a tablespoon and not a dessert spoon, because you'll be given 2/3 of the dose of what you're supposed to be given. Okay. On the second page, there's just continuing, same thing. 16 ounces is 480, and so on and so forth. When we look at the other measurements in the middle of that second page, this is what we have to pay a little bit of attention to, because this is where you'll see orders that will differ from what you get from pharmacy, okay? Where 1 gram, this is where we couldn't learn as Americans, 1 gram is 1,000 milligrams, okay? And 1 milligram is 1,000 micrograms, okay? So if you see things, and we'll go through some examples of that, converting back and forth, we do that all the time, okay? Hopefully we're gonna do it for you, but I want you to be able to at least understand how we do it, okay? And then we measure potassium in milliequivalents. Now don't ask me what a milliequivalent is, I don't want to bore you with the chemistry, because quite frankly I don't remember. But all I know is remember potassium is milliequivalents, okay, that's a chemical term, and then there's some other things. So what I've done is just put together a couple examples for you on what do we do. And if you can, I'll try to stay out of the way here. I'm going to trip.
You come to the table.
If I trip over these cords, you're going to have to pick me up because I'm recovering from a broken ankle. So I'm still not 100% recovered. That was the problem with that Harley I bought. They have no chance when you come in contact with a pickup truck. Just so you know. Pickup truck wins every time.
You know how to lift.
Okay? Anyway, okay, so here's the example I have for you.
Yeah.
Okay.
You don't wanna do it.
This is a real life example of what we do, okay, in the business, okay? A patient has an order for morphine, 5 to 10 milligrams every 4 hours, and the pharmacy sends morphine 20 milligrams per milliliter. What's the correct dose? How much do we give? Okay? Now, if you get from us, it's going to be all labeled for you, okay? I just want you to understand a little bit of this because it will totally tell you exactly how much to give. But some places don't. You may end up in a place that doesn't. So, how do we figure out, hello kitty, okay, how much morphine to give? So if we have, I'm really going to have to stand over here, but our concentration is 20 milligrams of morphine in 1 milliliter, correct? That's what it says, okay? We want to give either 5 milligrams or 10 milligrams. So the question is, how much do we give the resident, okay? And here's from the old math days, if you remember your old math days, is in order to figure out that, you have to divide by the same amount. So what you want to know is how many 5s are there in 20? Can you do that for me?
4.
Very good, okay? So if we say there's 4, we want 1/4 of a milliliter,
Oh.
0.25, okay? Okay? We do the same thing with 10s. How many 10s in 20?
2.
So we want to give a half of a milliliter, 0.5. Okay, so the answer is 0.25 to 0.5, okay? Here's what I want you to take away, okay? If this number, the 5 milligrams, is less than this number, what you're giving has to be less than this, okay? That's the common sense piece I want you to take, not the math, but if what you're giving is less, then you have to give less than this. Vice versa, if I said to you, I want to give him 40 milligrams, you'd know it'd have to be more. 2, you'd have to give 2 milliliters to equal 40, okay? That's what I want you to remember. If for some reason this is less, then you're given less than that, okay? And here's the reason I tell you this. You will see this if you deal with any kind of hospice care, okay? This is the drug of choice in treating pain with folks with hospice. And the reason is because you have to give so little amount to get so much morphine. It's very concentrated. You know, you don't want to give a person 15 mLs of morphine and try and dribble it down their face when they're very, very sick. So we use this drug because we give small amounts and it works really, really well. However, it's very dangerous. Okay? Because of that high concentration, there was a nursing home in Albany, New York in 1999 where the nurse read that to read 5 mLs instead of 5 milligrams. So she gave 5 mLs. What's 5 times 20? 100. She got a person, 2 people died in a nursing home over a weekend who had gotten 100 milligrams of morphine. Okay? Labeled perfectly, made the front page of the Albany newspaper. I was supervising the pharmacy that supplied. We did everything right. Okay? So that's all I really want you to remember. This is less, this has got to be less. Okay? Here's the other thing that I tell my folks every single day in the pharmacy. That's an exaggeration. At least once a week in the pharmacy, I say this: don't guess. Never guess. Pick up the phone and ask a question. Okay? We're there to answer your questions anytime you pick up the phone and ask. Okay? Even if it's off hours, we always have a pharmacist on call. You can get in touch with us. Okay? If you're not sure of something, ask the question. Okay? Don't guess. Okay? We're always there to help you. Okay?
Can I ask you a question
Sure.
about self-administrating pumps in the hospital? Is there any way that a patient, well, what I want to know is there any way that a patient can overdose themselves? Oh, there just isn't.
No,
Okay,
here's the
all
deal.
right.
Okay,
I was-
when I did my accident this spring,
Uh-huh,
I had an open fracture, so I was in the hospital for 3 days, and the first night I had a morphine pump.
yes.
I'd never had one before. That was pretty good.
Oh, yeah.
But the bottom line is,
But not just
when-
that, you're
no,
confused too.
no,
You're not
I
always.
wasn't confused. I knew
Oh,
exactly
okay.
what. Anyway, but anyway, no. With those pumps, if you click that pump
Yes.
and it releases morphine, it dings. Okay.
Right, it dings,
If you
yes.
keep clicking, it ain't dinging.
Oh,
So I figured out how often I could click for a ding. Okay, so it really
Because
releases.
in my experience, I was kind of out of it. I had just
I
come out of
was out of it
surgery and I
too.
had a pump. And the nurse told me real quickly before
Yeah.
she ran out the room, you know, something about it dinging. So every time I heard that thing ding, I thought, I've got to push it.
That was you pushing. I kept going like this, waiting for a ding.
I'm
You know,
completely
the funny part
exhausted,
is-
but I'm like, I've got to stay awake.
I knew how to program those things, but I couldn't couldn't touch it because I
She
didn't.
came in and she looked at it and saw that it was
Yeah.
empty.
You can't,
She
you can't,
took
you
it
can't do
away.
that.
She didn't bring me
You
another
would stop breathing pretty quickly if you could just keep digging
So
that.
you can't do that, because I
No.
just, I mean, I just like there thinking,
Unfortunately, the
it's
answer
my
is.
job to listen for this ding.
Yeah.
And
And I needed more
So I
frequent
struggled
dings,
to
let me
stay
tell
with
you.
it.
I needed more frequent dings that first night. let me tell you.
I had one too after a
Did you?
hysterectomy.
Yeah.
Yes, that's what.
But my
mine
husband was kind enough
He was
that if I moaned, he would come over
pushed the button?
and push the button.
Wow.
Well, I thought that was very kind of him because he was constantly meh. Every time I'd moan, meh. And it was the placebo effect because he
Oh,
also
yeah.
thought, oh, geez, yeah.
That's so kind of him.
But it was kind of odd because I
pretty
looked at
funny.
this man who was standing there and I thought, I leaned over my husband. I said, "Who's that man standing at me?" And my husband turned around and he said, "Baby, that's your father." I'm like, "Don't touch that thing again," because I thought my husband was just like overdosing me with yeah. He'd come near me. I'm
The
like,
pain was great though. Half of the pain
Yeah, it was.
It didn't make me
Anyway,
feel
all right.
good. It made me
Oh,
feel sick.
Yeah,
Maybe
I can
do
it
that.
wasn't
Mhm.
it.
No, I like
I
it.
can't take
I like it. Anyway. All
yeah.
right, let's go on to the next. Let's go on to the next. A doctor writes an order for levothyroxine 1/10 of a milligram. So if you go on the backside of the sheet, this is what will help us. Pharmacy sends 100 micrograms, and the question is this correct? Okay, and again, this is a conversion within the metric system. So we said on your paper that 1 milligram equals 1,000 micrograms. Okay? So we want to do basically the same thing. The doctor wrote for 1/10 of a milligram, which is a terrible order, but I mean, he did write it that way. Okay? So he writes for 0.1 milligrams. Okay? And the question is that right? So how do you do it? You do the same thing. Okay? So if you divide 1,000, you know, there's 1/10, there will be 10 of those. Okay? So you divide 1,000 by 10, you get 100 micrograms. Okay? And so the answer is that is correct. But you will see this. Lots of times prescribers will write in milligrams for this drug that comes in micrograms. So we're going to send you the equivalent microgram. Okay, it won't line up exactly with what your order says. But again, ask the question if you're not sure. If we send something that says 100 micrograms and you say that doesn't match my order, call. Okay, we'll assure you because maybe it was wrong. Probably won't be, but we'll just make sure, don't guess. Make sure you know what you're doing. Okay. The next one, we talked about this. It's pretty simple. It says pharmacy, you know, it's the conversion between the approximate and the exact. And again, the question is it the same thing? And the answer is yes, it is in fact the same thing. One manufacturer might say 5 grains is 300, the other might say 325. We don't see this much anymore. We used to years ago, so I threw it in there. I'm not even sure why. But you may see that, okay? They'll write for ferrous, although I do see a 5 grain ferrous sulfate occasionally written for, but most of the time it's in milligrams. Okay? Here's another quick one for you. Potassium, which we measure in milliequivalents, except for the liquid we measure in percents, which is really fluid. But the order is for potassium 20 milliequivalents a day, and you ask for liquid, and so we send potassium 10%, which is 20 milliequivalents, which is what we want, per tablespoon, okay? The question is, what's the dose, okay? And all I'm looking for you to say here is, how much is a tablespoon? We just talked about that. A tablespoon is 15 milliliters, so that's the equivalent of a tablespoon. You're going to use, except when you can't find the dose cups, to go to the kitchen. But you want to use 1 tablespoon is 15 milliliters. That's all I'm trying to accomplish here.
I have a question.
Sure.
If we have a resident with a liquid dosage, can we ask for you guys to send us extra dose cups in case they go missing?
Sure. We sell you dose cups any day of the week. I mean, we'll
haven't
send a
had-
sleeve of dose cups.
We have had them going missing.
Okay. So
We lose them.
of those cups, just
Yeah.
little plastic things.
I'd rather
Yeah, we
have
don't
those
typically
cups
send
than
those.
those.
Those usually
It's
come.
hard
Those
to
are
keep
those are
processing.
part. So good. Okay. All right. So that's again. I'm not even gonna go over the last one. That's literally is just kind of a thing to say. Don't guess. Trust your gut a little bit. If something doesn't feel right, answer the question. Your gut usually is right. I mean, it's surprising that is. There's a good book called Blink. If you've never read that book, tells you to trust your gut. It's a really good book. Okay, grab your books. We're going to spend the next bit of time going over the medication classes. And again, what I told you is I'm gonna try to give you a little bit of information about each class of drugs that you hopefully will find helpful. You won't remember half of it, you won't remember a tenth of it, but you'll have your reference if you want to go through. So what the rule says literally is we're supposed to review each class of meds, and that's what we'll do really in what seems like an eternity, but it'll go by fairly quickly for you, and hopefully give you some good tidbits on some
My
different
sister's a
things.
nurse, so we just pick up the phone and call her.
There you go. So the first category is Tylenol or acetaminophen, okay? We talked about Tylenol, over-the-counter benign, but really not.
What part of
okay?
the book are we in?
We are on page 5. Sorry about that.
I don't know, you can trust
Okay,
her.
Tylenol is obviously used for a couple things. It's used for pain, it's used for fever, okay? And it is, again, the #1 drug for blowing out livers in this country, okay? Right now, and this is probably gonna change fairly soon, the maximum amount of Tylenol you wanna take in a 24-hour period is 4 grams, okay? Now that sounds like a lot, but it's really not. That is the equivalent of 8 500 milligram tablets. So if you have an order that says 500 milligrams, 2 tablets every 4 hours, that's more than 4 grams. Okay, so you get there quick. It's the equivalent of 12 325 milligram tablets.
What
So
was
you can
the
get the fin.
500?
500 is 8.
8
Okay, 4
tabs?
grams. There's most likely that recommendation is going to drop to 3 grams.
Oh.
Okay, more likely. Now, that liver failure is associated with long-term use, okay? So if somebody takes 4 grams or 5 grams of Tylenol for a week for something short-term, it's probably not going to be a problem. But if they're doing it for a long time, even 3 over a long time, especially in elderly folks, you may see some problems,
But the
okay?
doctors push it, that and Advil.
Ibuprofen, that's
Advil,
what
yeah.
kills me,
Oh, yeah,
my
they're always
doctors
Yeah,
push
well,
ibuprofen.
they should, okay? Follow the directions. I mean,
Is
for
it a good idea, like, I'm talking about us right now, not